Hi, I'm Cindy Stanton, and I started with Dr. Roney in his office a little over, well, about a year ago. And I came in for neuropathy because I've had a problem with neuropathy for quite a while, and that is how I started in here. Then, after quite a few months, and my feet getting better, and the neuropathy getting better, I was still tired. I was still sluggish. I was having leg cramps and foot cramps until it was keeping me up at night, and I was getting worse and worse as far as that was going on. And I just figured it was part of the getting older thing, even though I had it since I was in my 20s. I've had leg cramps and foot cramps, and told I had lupus or I've had this or that. I've been to every doctor, internists, anything you can imagine I've been to. And Dr. Roney said, have you ever been diagnosed with Hashimoto's thyroid? And I said, no, I haven't. And have you ever been checked for that? And I said, no, I haven't. And so, needless to say, we took some tests, and I do have Hashimoto's. And if you read everything and the symptoms, it's everything that I've been going through and I've been explaining to doctor after doctor. And needless to say, finally, lo and behold, Dr. Roney has found it. I was always told just to up my thyroid medication, which hasn't really ever helped. And so now he has me on supplements, and natural supplements, which I love, and I do that. I watch what I eat. I watch my sugar intake. I do the things that Dr. Roney tells me to do. I love the office. They're all very helpful, and so not only have I came in for neuropathy, which is better, find out that I have an autoimmune, Hashimoto's, which is much better and under control, much more than I've ever been for 30 years. But I also get physical therapy, and I get a chiropractor, and I get the whole works, and I'm very satisfied with everything here. And the office is great. It's very easy accessible, and I would definitely have anyone that would want to talk to me, call me.
Now you're as far as, because a lot of the thyroid patients, probably very similar, because we know most diagnosis of thyroid conditions now, about 60-65% are Hashimoto's, and the other probably 20% are conditions that aren't specifically thyroid problems, they're other problems. So when you were talking about Hashimoto's, your symptoms, right, other than the thyroid symptoms, you were also getting a lot of just pain in joints, chronic neck pain, chronic problems in the body.
Yes.
Almost a fibromyalgia-like diagnosis as well, correct?
Definitely.
Yeah.
I mean, I've been told I have fibromyalgia. I've been told I've had, there's nothing I haven't had since I was 30-some years old. And, you know, it's scary whenever, you know, my first time I was told I had lupus, I think I was 27 years old.
Right.
And I didn't know what lupus was, and I don't think they really knew what lupus was.
Right. And did you have lupus?
No.
No. You had, what we now know is you had an autoimmune condition probably for 20 plus years that was affecting your thyroid, right? Yeah. Now, with the treatment and natural supplementation, and what we're doing is controlling your immune system. So tell me, as far as, I know the thyroid, you know, your symptoms overall are better, but how do you feel from a achiness, crampiness, tired, sluggish? Are you overall better with that too?
I'm overall better with that, yes. I mean, I have days, which we've talked about, and especially, you know, holidays or birthdays or this or that, I go off the deep end.
You can control it, right?
I can control it, and I know what to do.
Perfect.
And I know, yes.
Perfect. That's the beauty of it, because again, for people watching, our goal is to allow you to have the control.
Yes.
And you definitely feel like, and I don't want to put words in you, but you definitely feel, because you've told me many times that I feel like, yeah, I now know what I need and need not do. Exactly. I know what to take and what not to take, and I can control a lot of these symptoms. Now, just for everybody too, some are still there. You're not 100% better, and I don't want to ever say that that is even a possibility. But overall, function-wise, give me a percentage of better since you started with me.
Definitely, I have to say I'm anywhere between 75 and 85, and that's depending on myself.
For yourself, beautiful. That's the beauty.
Yes.
So there's hope, right?
Right. Oh, yes.
Yeah, that's the thing.
It's wonderful to know that it's not just because I'm 50-some.
Right, and all this wasn't in your head for the last
Exactly.
20 years. That other doctors just
have told me pretty much that yes, it is in your head. It's just that this or that, or it's some disease.
Right, but they weren't sure exactly what that disease was. Perfect. Sam. Well, I say this with complete honesty. We love having you here. You worked hard, and that's the other key to this. I tell patients all the time that commitment-wise, there's going to be some things that have to be done, and if I do my job and you do your job, we're gonna get really good results with most people that walk in here. So the commitment, you have to be applauded for that. So
thank you.
I always say thank you for that, and we love having you here. And as always, we'll do anything for you. So
thank you very much.
You're welcome.